في الأرض لمسرفون.
Indeed, whoever saves one life, it is as if he has saved the entire mankind. This is the key towards voluntary blood donation in any Islamic country. With this, we will move on to the first talk of this session, which is the welcome address. I will introduce a visionary with a strong belief that health is a basic human right and should be free for all. As a second year medical student, he established the blood bank of PWA in Civil Hospital, operated by the students of Dow Medical College. A cardiothoracic surgeon, philanthropist, and humanitarian, he is one of the co founders and president of Indus Hospital and Health Network. I would like to invite Dr. Abdul Bari Khan to the stage for the welcome address.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. His Excellency Mr. Alfred Grenes, Ambassador of Federal Republic of Germany, my friend Dr. Zafar Mirza, Dr. Durinaz, Masuma, delegates from foreign countries and from Pakistan. Ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Of Indus Hospital is the faith in Allah subhanahu wa ta'ala, and faith is from here. When we were starting, majority of 99.9% were skeptical. We may be able to make it, but to run it, impossible. Someone gave you a month, 6 months, and a year. Alhamdulillah, starting with one hospital, now we have 15 hospitals across Pakistan. We have public health and primary health programs across Pakistan in 51 districts of Pakistan. We have 4 renal blood centers, physical rehabilitation centers. Our first year budget was $1 million, and the recent budget, which passed in June, is $180 million. And it is all from philanthropic support from Pakistanis in Pakistan and expat Pakistani across the globe and international organizations. It gives me great pleasure to be amongst you today at the first ever Transfusion Conference. It is indeed an honor. As I stand before you today, I want to appreciate the invaluable work of all of you, the experts in the field of blood transfusion services. You are truly responsible for the success of this conference. Congratulations. This is a triumph for us all, and especially you. Before we embark on what I am sure will be very valuable sessions, I want to reflect upon my journey with Indus, particularly in the realm of blood transfusion services. Growing up in Karachi, I completed my medical education in Dow Medical College and a Link Civil Hospital, Karachi. As a student, I remember being shocked to see a tertiary care hospital being run without a sustainable supply of blood. But what was more shocking to me was that the blood donors that we had were a group that overwhelmingly include drug addicts. They would live outside the hospital and sell their blood as much as twice a week. It is of no surprise then that these professional blood donors had everything apart from blood in their systems: hepatitis, HIV, malaria, syphilis, and more. This bleak reality motivated us, mere student at the time, to establish the first voluntary blood bank under Patients Welfare Association in 1982, still run by the students of Dow Medical College. I can see many sitting in the audience. The sole aim was to introduce the nascent concept of blood donor voluntarism in Pakistan. Esteemed guests, whenever I speak about the then reality of blood donation in Pakistan, I like to recount some patient stories that most aptly reflect this. For instance, there was a pregnant woman who was bleeding out in the labor room, and saving both her and the baby was entirely reliant on safe blood being donated. Unfortunately, when her husband was asked to donate the blood to save his family, he responded by saying that if he were to do that, his wife would become his sister. His own father, in fact, threatened to end his life if his son were to donate blood, and said that if his daughter-in-law were to die, he would simply find a new one. This was the context in which we developed the blood transfusion services in Pakistan. While it may sound ludicrous now, this was indeed the context PWA was working in. In 1981, professional donors who unfortunately we were still reliant on went on a strike, demanding the pay raise, and so there was no blood left at all, and it was becoming increasingly difficult to save lives. However, this was a turning point for PWA, and we promised ourselves that from this day forward, we would no longer stand for the care being dictated by the one's ability to pay. Eventually, we created the Indus Hospital, and I first met Dr. Sabah Jamal, who is now the Senior Director, Pathology and Blood Transfusion Services at Indus. From the very first day I met Dr. Sabah to this day, I remain inspired by her deep passion and dedication towards realizing her vision of 100% voluntary blood donation at a centralized blood center. With her vision integrated within Indus, we embarked on what has absolutely been a remarkable journey. I have no doubt in my mind that without her championing for this cause day and night, we would not have been able to achieve the feats that we have. For instance, Indus now stands at the forefront of centralized blood banking in Pakistan, with 4 regional blood centers and 21 hospital blood banks across Sindh and Punjab, allowing us to serve over 7,800 hospital beds and provides life-saving blood to over 700,000 patients annually. Witnessing every day the profound impact all of this has on our patients, I am taken aback in time when I was a student, seeing the deplorable state of blood banking in Pakistan, and cannot help but bow in gratitude and humility. To Dr. Sabah, I would just like to say that your dedication and compassion to helping save lives every day is truly inspirational. You lead your team by example, and on behalf of Indus Hospital and Health Network, I assure you that it is our collective responsibility to support your efforts and make them more effective. I also want to take this opportunity to acknowledge and celebrate the tremendous contributions of the German Development Bank, KfW, and the German Agency for International Cooperation. Masuma, you have been very helpful. With their support, 15 regional blood centers have been established and 84 hospital blood banks have been equipped nationwide. Certainly, such valuable investment in infrastructure and technology, along with technical support under the banner of the Pak-German Joint Safe Blood Transfusion Projects, are the backbone of a stronger, more resilient system. Moreover, our public-private partnership with provincial governments have not only increased access to the safe blood, but they have also helped grow sustainable system in the public sector through capacity building and training. Whilst this commitment to excellence in blood banking and transfusion medicine has surely been instrumental in helping save countless lives, I must remark that there are bounds of progress still to be made, particularly for blood safety and accessibility. However, with the avenues of collaboration and knowledge sharing, I have been informed of at Transfusion 2023, I am sure that we are on the right track, particularly in lieu of the astronomical numbers that Transfusion 2023 is anticipated to engage. Remarkably, Transfusion 2023 has also been able to engage many shining stars in the form of enterprising, forward-looking healthcare professionals who triumphantly displayed themselves as the true reformers of healthcare. As leaders, it is our duty to empower them, nurture them, support them, and give them platform such as Transfusion 2023, so that they can truly change the status quo of blood transfusion banking and transfusion in not only Pakistan, but also globally. Conferences like Transfusion always provide a platform for experts to exchange ideas, share their experiences, inspire innovation, and build networks. And I'm so pleased to see that all of you have seized this opportunity to learn from one another, to foster partnership, and to create a supportive community dedicated to improving the lives of our fellow citizens. I encourage all of you to continue engage in trainings, quality improvements, research and innovation. It is only through these that we can experience true progress. I also urge you, our institutions and public sector to continue supporting research and training in the blood banking and transfusion medicine. The development of skilled professionals and the establishment of well-equipped, high-quality and safe facilities are essential to meet the growing demands for blood banking and transfusion medicine in the country. In conclusion, let us remember that our work has a profound impact on the lives of individuals and the well-being of our society as a whole. We must work together, push the boundaries of science, and extend our expertise to those in need to make blood transfusion safe, more accessible, and more efficient. And I have no doubt that this conference is just the start of what is going to be a remarkable journey of taking Pakistan to greater heights in the field of blood banking and transfusion medicine. I feel so blessed to be here today to show my appreciation for all of your hard work and dedication. Thank you again to Transfusion 2023 organizing committee for inviting me to be the part of this honorable occasion. Taking the opportunity of the presence of His Excellency, the Ambassador of Federal Republic of Germany, I will request him that this collaboration should continue. And together we can, I know it is the responsibility is that bilateral collaboration, I know there has been some lacking from our part, but I assure you, we'll make all efforts as a society of hematology and blood banking, we will take it to the government that this collaboration should continue. Thank you all.
Thank you, Dr. Bari. Indeed, we have come a long way, a long, long way. And because of that, in the spirit of gratitude and recognition, we now take a moment to express our deepest appreciation before we embark on the formal program. A monumental depth of thanks is owed to the Federal Republic of Germany for its visionary initiative in bolstering blood safety in Pakistan. This initiative set into motion in 2007, through the harmonious collaboration of the Pak-German joint project, marked the genesis of a transformative journey, and it is a transformation. The journey started with the creation of Safe Blood Transfusion Program in 2010, generously supported with a 27 million euro investment by the German Agency of Cooperation, also known as GIZ, the German Development Bank, KfW. This invaluable contribution paved the way for operationalization of 15 regional blood centers and 83 hospital blood banks across Pakistan. Legislative reforms paved the way for the establishment and activation of provincial blood transfusion authorities, which we now know as Sindh Blood Transfusion Authority, Punjab Blood Transfusion Authority, and indeed, the German government's steadfast commitment has thrust the once neglected issue of blood safety into the spotlight, sparking absolute crucial conversations around blood safety among the blood banking community and policymakers alike. Today, as we convene for this conference, it stands as a resounding tribute to the indelible mark of the Pak-German partnership. Together, we have wrought radical reforms, safeguarding the lives of the most vulnerable within Pakistan's population. This is a testament to the power of collaboration and shared dedication to a safer, healthier future. We now invite His Excellency, the Ambassador of Federal Republic of Germany to Pakistan, Mr. Alfred Granus, to elaborate on the German support for Pakistan's health sector.
Dr. Abdul Bari Khan, Dr. Zafar Mirza, Dr. Jabba Ismail, General Dr. Salim Rena, and Professor Dr. Mohammed Munshid. Let me start with saying that this is really an impressive trajectory, an impressive history that shows us what empathy and continued dedication actually really can do for the betterment of human life. I must say my deepest and most heartfelt respect for all those people that have been part of this journey and are still on it and are also dedicated and determined to continue that. Ladies and gentlemen, I'm very pleased also to be here in Karachi for this groundbreaking international conference on blood transfusion. It's a very important topic, as we've seen. I'm honored to stand before you to highlight the significant strides that German-Pakistan Development Cooperation has made in the field of healthcare in Pakistan. The Safe Blood Transfusion Program in Pakistan is an important initiative supported by the German government, with German funds provided through KfW, the German Development Bank. 15 state-of-the-art regional blood centers were built and equipped according to international standards. Those centers ensure the availability of safe and quality blood products for medical purposes. These centers are established and blood banks upgraded in order to address the issues related to unsafe blood transfusions, as we have not just heard how this used to be. No, but those centers now can lead to, or those unsafe blood transfusions will lead to blood-borne diseases like HIV, hepatitis B and C, and all sorts of other things we don't want to hear about. This is really a great achievement. The safe blood transfusion system serves now, as far as I know, 95 million people. That's difficult to say, but about 40% of the Pakistani population, and we hope it will be more. I'm also very pleased that some of these regional blood centers are now being operated through public-private partnerships. I've heard, for example, that the Fatimid is doing a great job in the blood centers in Karachi and Nawab Shah. Sakar Blood Bank efficiently running the regional blood center in Sakar, and Indus Hospital doing an excellent job in Multan, Bawalpur, and Jamshedpur. I would like to express my appreciation also of the government of Pakistan, Department of Health, for their cooperation. KFW and government of Pakistan consultants for the dedicated work, the private partners and the organizers behind this commendable conference for their support and good work. You all have put a lot of efforts in making the safe blood transfusion program a success. But beyond that, Germany and Pakistan have been partners in the development and strengthening of Pakistan's healthcare system for many years through KFW, mainly for infrastructure investments, and through GIZ for technical support. I said, in fact, already in the 1980s, with German support through KFW, the Children's Hospital in Quetta, Balochistan was established. In the 1990s, the focus of our support shifted towards the reproductive health and family planning. In the early 2000s, following also the 2005 earthquake, the renovation and construction of healthcare facilities in Khyber Pakhtunkhwa as well as in Azad, Jammu and Kashmir was financed through Germany's financial cooperation branch, KFW. These endeavors have been complemented by the support of disease control and prevention efforts to combat infectious diseases through immunization programs. Today, the Pakistani-German collaborative efforts encompass a wide range of initiatives, spanning from infrastructure to health insurance and social protection. Social health protection in KP and Gilgit has been supported through the German Development Corporation since 2015. Health insurance to the poorest population segment is being provided. I'm very glad to see that this model, the so-called Sehat Zaulat program, has been so successful that the KP government has scaled up these services across the whole province. That is also something like what a development cooperation project should do. Set a model and an example, so then it can be carried on and integrated into the national systems. But healthcare is a universal right, a fundamental human need that knows no boundaries. The COVID-19 pandemic has underscored the interconnectedness of our world. In the face of this global challenge, we have seen that our strength lies in cooperation and solidarity. So, following the catastrophic 2022 floods, the German Development Corporation provides support to the Benazir Income Supports program to improve the health of mothers, adolescent girls and children with the Nashuma Numa conditional cash transfers program. So, the past few years have brought to the light the importance of a resilient and adaptable healthcare system. So our goal was to work hand in hand with Pakistan to support you to create a robust, efficient and equitable healthcare system that can withstand various challenges and shocks and serve the needs of all. As we look to the future, our commitment to social protection and healthcare cooperation remains unwavering. We are eager to explore new avenues for partnership, share best practices, and learn also we from the experiences of our Pakistani counterparts. We believe that through international cooperation and a shared commitment to public health, a healthier, more prosperous Pakistan can be built. In conclusion, let me express my gratitude for the enduring partnership between Germany and Pakistan in the health sector. Together, we can make a positive impact on the lives of millions of people, and by working hand in hand, we can build a brighter, healthier future for all. Thank you very much, and a successful conference.
Thank you, His Excellency, Mr. Alfred. So our next speaker is a project design and implementation specialist with an extensive practical experience of working in the public health sector. With an experience of more than 18 years in government and donor agencies, she has worked in WHO, UNFPA, and FHI, and since 2009, she is working with KfW, German Development Bank, looking after the health portfolio. Dr. Masooma Zaidi has been involved in mega and flagship initiatives of various thematic backgrounds, including health systems and safe blood transfusion, among many. I now invite Dr. Masooma Zaidi to enlighten the audience on Pakistan blood safety reforms and German support.
Honorable Dr. Badi Khan, the President of Indus Hospital, the German Ambassador, Mr. Alfred Granos, the Councillor, Mr. Rudiger Lotz, Dr. Zafar Mirza, the WHO representative, ladies and gentlemen, Assalamu alaikum, and a very good morning. I was limping because many of you in the morning were asking me what's wrong, you were disappearing for so long. Well, I was walking a month back and somehow my kind of tendon and the muscles, the calf muscles, got injured badly by itself. I did not hit myself. Some people said it's old age, but I believe it's the sportsman injury, so I'm all good. So thank you very much for all those who were extending their well-being for me. First of all, also I'm very delighted to be here on this very significant Safe Blood conference, and thank you very much to the organizers for inviting me. It's my first event after almost a month and a half, so I'm also very happy that I can again walk and be among you people. Safe Blood is also very close to my heart. I'm representing KfW, as you just heard, and KfW Development Bank has been mandated by the German Federal Ministry of Economic Cooperation and Development to work on various issues, including health issues. Currently, we have approximately 700 million euro support to Pakistan. It includes grants as well as loans. We mainly work in the sector of energy, in finance, social protection, and health and governance used to be there, but now it's replaced, and also sustainable economic development. In health particularly, the support is all in the form of grants, and it's almost more than 100 million euros. So quite a significant support. And majorly we work, as we heard, in the areas of reproductive health, family planning, social protection, social health protection, as you heard from the German ambassador mentioning the flagship project of social health protection, the health insurance, and last but not the least, safe blood transfusion, where also was quite a very, like a tremendous support, and I will just walk through the journey. Blood transfusion, an essential medical procedure, can be a life-saving measure for countless individuals facing critical health challenges. We all know that we have prevalence of more than 5% when we talk about hepatitis B, hepatitis C, even concentrated epidemic when we talk about HIV. And we all know how we are suffering from dengue outbreak these days. Almost, many of our relatives or some known people are there, and it's kind of critical. So, however, ensuring the safety and availability of blood for transfusion is of utmost importance. Pakistan, like many other developing countries, has faced numerous challenges in this area, ranging from inadequate infrastructure, regulation and enforcement of standards, blood banks and infrastructure, and hospitals, leading to inconsistencies in blood transfusion practices and lack of awareness, especially when we talk about voluntary blood donations. Safe blood transfusion is a universal human right, and provision of safe blood and blood components is the responsibility of the national healthcare system for the betterment of its population. Recognizing these challenges back in 2000, the discussion started maybe back in 2004, but the agreement between Germany and Pakistan was signed back in 2009, where the German government extended its support towards improving the blood transfusion services by committing 2 phases worth 25 million euro grant, and the project was implemented nationwide, where 15 state-of-art regional blood centers were built and fully equipped according to the international standards. And majority of these regional blood centers have capacity of more than 50,000 donations per year. In addition, 83 blood banks are upgraded and equipped. A waste disposal system strategy is in place. A central MIS is established. Relevant staff are trained through Indus and also through Shifa. And not only just trained here, many of the government officials had exposure visits to other developing countries so that they could come back and implement the same kind of standards in the country. Under the German Development Cooperation, this initiative was financed by KfW, the hardware, the infrastructure, and the soft component, which includes the capacity building, legislations, developing the blood laws, acts, was done by GIZ, mostly under phase 1. The overall investment has been instrumental in strengthening the blood transfusion services across Pakistan, ensuring that these regional blood centers and blood banks adhere to the international standards. This has not only enhanced the safety of blood transfusion for those who need, but has also improved the overall healthcare landscape in Pakistan. Moreover, German government support has extended beyond infrastructure and technical assistance. It has also encompassed public awareness campaigns aimed at educating communities about importance of voluntary blood donations, safe practices, and impact of their contributions. By fostering a culture of voluntary blood donation, GDC, the German Development Corporation, has played a pivotal role in ensuring a sustainable and reliable blood supply for patients across Pakistan. The impact of Germany's support towards a safe blood transfusion program in Pakistan cannot be overstated. It has not only saved countless lives, improved healthcare outcomes, but notably strengthened the bonds between the two nations. The collaborative efforts between Germany and Pakistan serve as a shining example of international cooperation and solidarity in the pursuit of a healthier and safer world. We are almost reaching completion, as phase 2 now is almost over, and already by now, more than 10 regional blood centers are running in full swings efficiently with high quality standards. Some definitely are run by the public sector, and some are run by the private sector, as you just heard from the German ambassador. We can, with pride, already see improvement of blood transfusion services in Pakistan and people having a better access to safe blood transfusion system. In conclusion, I express my deepest gratitude to the entire Safe Blood Transfusion program, the government of Pakistan. I can see, it's a very unique kind of a project where we all almost started back in 2010, and it's unbelievable that majority of the team is present right here, which is also very unique. We talk about Dr. Hassan Abbas Zahir at that time being with the Ministry of Health, and then devolution, of course, took place. It was then in a different manner, we kind of implemented the project. And then the project directors came from the provinces, and of course their dedication and their full efforts and support were required. Not only them, but it starts from the minister, trickles down till, I don't know, maybe the planning officer or maybe much lower. So every person really worked very dedicatedly for this noble cause. Definitely the media, who played a very important role when we talk about awareness, the awareness overall for the blood transfusion system and also for the voluntary blood donation campaigns. And I would also like to appreciate the work of our private partners, Fatimi, Sakhar Blood Bank, definitely Indus, who is Dr. Sabah Jamal, and her entire team are doing an excellent, commendable work when you see and you visit Multan, Bhavalpur, and Jamshoro. Last but not the least, of course, the German embassy, because I think it's a project where we could invite and we could have the German embassy involved at every step. They travel not only to Karachi, but I don't know, interiors of Sindh and so long. So I think this was really nice that, embassy was very much involved in one of the project. They are very busy people, but still they could come out and give time to this health sector, which already is kind of, shows commitment and highly appreciative. And last but not the least, the people who we don't really talk about, I mean, we, of course, the German government fundings were there, but also when, the people who implemented, GOPA consultants worked day and night selflessly. We had Mr. Gunter Merck starting from the beginning in 2010. And can you imagine, he stopped working in 2019, but today he came all the way from Germany after a gap of few years just to attend the closing of this project. Exactly. And then we have Mr. Zahid Mahmood, who, of course, again, traveled every corner of the country just to ensure that the quality, Germany is known for its quality standards. So when we talk about Germany, it's really quality. So, of course, there are so many, we have procurement departments, and so many different departments that can, be really after that. Are you meeting these criteria? So the consultants were really on their toes, going in every spot to ensure that every criteria is met. Almost now we have reached completion. Germany has done its part very successfully. And now it comes to handing it over to the government of Pakistan and the partners. So we really urge the country to kind of we all move together. And once we kind of part our ways, still continue the support, maybe other partners chip in, and then you continue, because blood safety is very important and critical, and it's a human right that needs to continue. So we heard that through the intervention, 95 million people have the access and reach for safe blood. People nationwide can have access to these. However, the journey doesn't stop. As I mentioned, Germany has completed its part, and now we just see that ensuring the availability of safe blood transfusion services for all those need continues. Thank you very much once again.
Thank you, Dr. Masuma. Your excitement was highly contagious. And we move on to our next speaker. And it gives me great pleasure to introduce the chief guest of Transfusion 2023, Dr. Zafar Mirza. Dr. Zafar Mirza is the current professor of health system and population health at Shifa Tamir-e-Millat University in Islamabad. He served as a special assistant to the Prime Minister on Health and led the national COVID-19 response successfully. With 16 years of international experience, he held roles such as Director for Health System Development at WHO and was responsible for 22 countries in Middle East, North Africa, and Western Asia. Additionally, he also served as a WHO representative in Iran and in many more key positions. He is an Eisenhower Fellow and a Britannia Scholar with a Master's in Public Health and has been on the faculty of Boston School of Public Health, joint faculty of WHO Harvard Medical School. I would invite Mr. Zafar Mirza, Dr. Zafar Mirza, to please come on the stage for the speech.
Bismillah ar-Rahman ar-Rahim. Thank you very much for a very kind introduction. Your Excellency, the German Ambassador in Pakistan, Mr. Alfred Granis, my long-standing friend and at the same time inspiration for me personally, Dr. Abdul Bari Khan, Dr. Sabah Jamal, who is the moving spirit behind this conference, and all the developments that Pakistan has seen through Indus hospital health and network in the area of safe blood transfusion. Dr. Masooma Zaidi, whom you just heard, and the way she was speaking, it was very obvious that she has really given her sweat and blood to this project, and I really thank you very much for that. It gives me a great pleasure, and I feel privileged to be here on this auspicious occasion of I just learned this morning that it is the 10th anniversary of the Indus network in terms of their establishment of the blood bank, which now has turned into its new building as a state of art, and I can say this with confidence, the best blood center in Pakistan. I happened to visit this. Dr. Bari Khan took me day before yesterday, and I was so impressed that I usually am not short of words, but I was short of words, because the kind of excellence that they have established and created there is really awesome. I would also like to, right in the beginning, would like to acknowledge as a former government servant, but also as a citizen of Pakistan, the debt that I feel personally towards the government of Germany for their immense contributions, not only in the health sector, but generally in the development of Pakistan. The bilateral relations between Germany and Pakistan are very wide-reaching, very long-standing, and are continuing, and I hope and pray and wish that they will continue with the same spirit. Very few people know, I would like to specially mention, apart from blood sector and safe blood transfusion and its promotion and development in Pakistan, I would like to talk a little bit more about the contribution that the German government has made, which His Excellency and Dr. Masooma also mentioned, but I want to be more explicit about it. And that is that the largest financial protection program in healthcare in Pakistan, that is Sehat Sahulat program, the government of Germany has played a very fundamental role in its establishment. The people of Pakistan who are now enjoying the financial protection when a family member gets sick and get admitted in a hospital is also by virtue of the technical support and the financial support that the government of Germany provided to the government of Pakistan to help establish this very impressive, very large, ever-evolving, and inshallah, going to be one of the best social health programs, social health protection programs in the region. And if that technical assistance and financial government was not available in the beginning of this program, this would not have been possible. So we are very thankful to you. I also stand here as a student of public health and health systems. And without mincing words, I would very explicitly would admit that the government of, actually the people of Pakistan are going through a very serious public health crisis, which is also very diverse. It is not limited to one disease. It is communicable diseases, it is non-communicable diseases, and most importantly, it is the risks to health which we are not being able to address effectively. And if risks to health are not addressed effectively, the natural consequence is their translation into diseases and the spread of diseases. One of the major risks to health are blood-borne diseases. Whether it is hepatitis C, whether it is hepatitis B, and the emerging epidemic of HIV/AIDS, we should not underestimate the way the HIV/AIDS is spreading in Pakistan. And one of the major risk factors behind this is unsafe blood and our social practices and medical practices, which make the people of Pakistan more vulnerable to be infected with these viruses. You would not have forgotten the HIV epidemic, AIDS epidemic, which happened in Ratodero in 2019, where hundreds of children got infected because of the reuse of the disposable syringe, which was infected with the blood of the HIV/AIDS patients. So when we talk about safe blood transfusion, we are talking about a large health problem, public health problem in Pakistan, which has to be dealt effectively. And one of the ways, not the only way, but one of the ways is to ensure that the blood transfusion, as and when and wherever it takes place, we have safe blood to transfuse to the people. I always give this example that we can continue to treat diseases, but if we do not address the underlying factors, the risk factors which I refer to, we will not be able to eradicate those problems. It is just like you have a floor where you have a defective tap water, which continuously water is dripping. You have two ways of dealing with this situation. You can continue to mop the floor, and you will be continuing that mopping of the floor for the rest of your life if you do not get the tap fixed. And fixing of tap is actually effectively dealing with the risk factors that we are talking about, and one of which is unsafe blood transfusion. I would particularly like to mention two very important issues which have been somewhat diplomatically have been mentioned by the previous speakers. I have been personally involved at one stage seeing the establishment of the regional blood centers, and I'm so pleased to know today that 15 of them are now not only built but equipped, and people are trained, and MIS systems are in place across the country. These regional blood centers is a very, very important development in the public health sector in Pakistan. And the vision was, and is, and must be, that these regional blood centers will act as hubs, and they will be spokes which will be located within the blood banks of the local hospitals. And each regional blood center will be linked with these local blood centers, and there will be a continued traffic between them. The reality is that the German government has played its role very, very well. And we, as I said earlier, we are very thankful to the government of Germany. But on our part, as government of Pakistan, we have not been able to cooperate reciprocally and as well as the government of Germany has given their cooperation and financial support to us. The result is that number of these regional blood centers are not operational at the moment. There is no other word but to say that it is very tragic on our part. And using this forum today, I would urge the leadership which are in decision-making positions in Pakistan today, both at federal level and at the provincial level, to please let us put our house in order and operationalize these regional blood centers and operationalize this hub and spoke model that we created. And as we heard from Dr. Masuma, that how much energy, how much money, and how much effort has gone into these. If these regional blood centers are working and linked with them, the local blood banks and transfusion centers are working, we can actually transform at least this one risk factor, which is responsible hugely for the spread of infectious diseases in Pakistan. As you know, and I don't need to go into telling you the gory details of how prevalent the hepatitis C has become in Pakistan and how we are sitting on the verge of a big, God forbid, but if we go by the epidemiological modeling, we are sitting on the verge of a HIV/AIDS epidemic in this country. We should not take these things very lightly. And secondly, I think it is also very important that bilateral cooperation takes place through bilateral cooperation. It's not unilateral. So we have to improve our cooperation strategy with our development partners, whether these are multilateral organizations or whether these are our bilateral development partners. In this area, I would urge and I would expect that this will be reported, and I want it to be reported as explicitly as I'm saying, that the current federal government and the provincial governments need to review the ways of working with our bilateral and multilateral partners. It is very, very critical, and I don't want to mince my words on this. Lastly, it is also very important to remind ourselves that it is not the brick and mortar and the trainings and the equipments that the German government has provided us in the form of setting up these regional blood centers, but also they have provided us a system approach, system support, health system development support in this area. And currently today, at federal level and at provincial levels, we have actually blood regulatory authorities. At least the structures now exist. And for this also, we received support from the German government in terms of technical assistance and in terms of financial assistance as well. There are varying degrees of operation and performance by these blood transfusion regulatory authorities in different provinces. Sindh is better, Punjab is somewhat working, and other provinces have to catch up a lot. The government needs to also do some governance reforms in order to separate the functions of regulation from service provision. When we talk about regulatory authorities, it is meaningless if we do not give them full autonomy for them to perform optimally. Currently, there are different estimates, and I don't want to commit any figure, but a large quantity of still the blood which is being transfused is unsafe in Pakistan. And most of it happens in the private sector. And the private sector labs and the blood transfusion and the way the blood is collected, stored, and transfused is highly objectionable. highly unsafe. This requires a very, very close regulation. We have now regulatory authorities, but they are not performing optimally. And we need not only to operationalize them, but also provide them a clear framework for their operation, that is separation of regulatory and service functions. I very happily also note that our friends from Islamic Republic of Iran are also attending this conference, and I welcome them wholeheartedly. One of the reasons why I mention this particularly is, and I also am very happy to note in the program of this conference, that there is a session on plasma fractionation. And there is a hyphen and it is written New Horizons. It indeed is a new horizon. And Islamic Republic of Iran and of course Germany is one of the pioneers in this area. They have set up plasma fractionation units. Iran also has set up a plasma fractionation unit. And I was just informed that now already Iran is exporting the blood components to even European countries and to African countries. We have to remember one thing, that the raw material for setting up these plasma fractionation centers, we are all carrying that raw material, and that is human blood. That's the raw material. With fifth largest population should be put to some purpose. And if properly this blood is collected, we can actually establish one of the largest plasma fractionation centers in Pakistan, which can serve the needs of South Asian countries, Central Asian countries, and even African countries, and later on maybe even European countries. But that requires a humongous effort. And I would also urge Dr. Bari that after having set up this state-of-art blood center, I think their New Horizon should also be working closely with the government to actually establish plasma fractionation manufacturing unit in Pakistan. Once again, congratulations on all the good work, and I hope and wish that the few recommendations, without mincing words, that I have made will reach those corners where the decisions are made, and we will put our house in order to optimally benefit and continue to benefit from multilateral and especially bilateral cooperation in health sector, where we really need a lot to be done with the government of Germany. Thank you very much.
Thank you, Dr. Zafar. We now proceed to shield distribution. I would request Dr. Abdul Bari Khan to come on the stage to present the shields to our esteemed speakers, please. And I also request Dr. Sabah Jamal to come on the stage for this shield distribution. I invite His Excellency, Mr. Alfred Granus, to receive the shield. I now request His Excellency, Mr. Alfred Granus, to present the shield to Dr. Abdul Bari Khan. And I would request the chief guest, Dr. Zafar Zaidi, to please come on the stage. Dr. Zafar Mirza, to please come on the stage. Yes, I did correct, Dr. Zafar Mirza. I now request His Excellency and Dr. Bari to present the shield to Dr. Zafar Mirza. दे दिया? Okay, good, great. Okay.
जफर मिर्जा भी ऐड कर देना तीनों मिलके मासूमा
जी. And I would request all of you to please stay on the stage and Dr. Masuma Zaidi to please come on the stage and receive the shield. I invite, thank you, Dr. Masuma. I invite Mr. Gunter Merck, public health expert and initiating team lead for Safe Blood Transfusion Program, GOPA Worldwide Consultants GmbH, Germany, to receive the shield as a recognition of his services from His Excellency Dr. Zafar Mirza and Dr. Abdul Bari Khan. Please come again. I'm delighted to invite Mr. Zahid Mahmood, the dedicated team lead and country representative GOPA in Pakistan, to honor him for his remarkable and tireless services in overseeing this project from inception to successful operationalization since 2010. Right. So I request His Excellency Dr. Bari and Dr. Zafar Mirza to please stay on the stage for a couple of more minutes because we have two and His Excellency, it can't be complete without you. So we have two very special award categories, and we have our next award category is for the Lifetime Achievement Award, dedicated to honoring the trailblazer of blood safety reforms in Pakistan, none other than Professor Dr. Hassan Abbas Zahir. He has made an outstanding and noteworthy contribution to enhancing blood safety in the country. Professor Hassan Abbas has an impressive track record. He has served as the former national coordinator for Safe Blood Transfusion Program and chairman of Islamabad Blood Transfusion Authority. In addition to this, he has held the position of head of pathology department at PIMS in Islamabad. Presently, he serves as an advisor to World Health Organization's Global Advisory Group on Blood Regulation, Availability, and Safety. Moreover, he acts as an independent health consultant, offering his expertise in various critical areas: blood safety, thalassemia, hemophilia, HIV, plasma fractionation, COVID, medical audits. He provides these consultancy services to a range of international and national organizations. Thank you, Dr. Hassan, for receiving this award. Our next award is also a very special award. It's called the Lifetime Service Award. Before we present this award, since it is very close to our heart and it's actually very personally linked to us, dear delegates, let's journey back to 2005 and 2006, a time when blood banking in Pakistan was hopelessly neglected and desperately lacking crucial technical expertise. It was then that Miss Elaine Williamson, an American specialist in blood banking, was residing in Karachi as a wife of a German diplomat, again German. She generously offered her time and expertise to collaborate for capacity development with the team of blood transfusion services, now the Indus Hospital and Health Network's blood transfusion services. Elaine's influence was profound. She played a pivotal role in transforming our current technical managers into master trainers, laying the foundation for modernizing and radically improving all the processes of safe blood transfusion, from donor's vein to patient's vein. This endeavor laid the groundwork for Pakistan's pioneering centralized voluntary donor-reliant blood center, materializing in 2013 as the Indus Blood Center. Without her exceptional contributions, this groundbreaking project would have remained a dream. Today, we truly honor a, a trailblazer. It is with great privilege that I invite Miss Elaine Williamson. She is the Director of Reagent Production at the American Red Cross, USA, to grace the stage and accept the Lifetime Service Award. We recognize her extraordinary commitment to advancing blood transfusion safety in Pakistan. And as a personal gesture of appreciation, we invite our guests to stand and applaud for Ms. Elaine for her exceptional dedication to Pakistan.
I would like to give a personal thank you. She was the one who believed in our dream, in my dream. And actually, it's a heartfelt thank you. Nobody gives such time voluntarily. She was like passionate, worked for 18 months during her husband's stay here as a German diplomat. And in fact, Dirk even, he became one of our IT specialists. We were working, literally converted everything, master trainers within 18 months. It's a personal gratitude. I am her slave for life. Thank you very much.
Elaine, would you like to say a few words? A few words.
Thank you. Thank you very much. I really do accept this award, but it's on behalf of the team that I trained. Really, their dedication, they're my heroes. They showed up to work every day. They learned new techniques, all for the benefit of the safety of the patient. So really, I accept it on behalf of all of the team that I work with that are still working every day for safe blood transfusion in Pakistan. So thank you very much.
I would request, please, Dr. Bari and Dr. Zafar Mirza and His Excellency to please stay on the stage. And I would like to invite Dr. Rotiga Lotz, the Consul General of Karachi, of Germany in Karachi. Okay, and yeah, so it's our tradition to present a token as a sign of Pakistan's hospitality and also Sindh's culture. So I would invite Dr. Durinaz Jamal to please come on the stage and present this token. Which is called Ajrak, yes. Dr. Durinaz Jamal is the secretary of Sindh Blood Transfusion Authority. In giant scarf.
Thank you very much.
Thank you, Dr. Bari, Dr. Zafar Mirza, and His Excellency. Okay, so with this, we conclude our plenary session and move on to the first session of this event, which is on fostering voluntary blood donation. To chair the session, I invite Professor Dr. Salim Rana, the President of Pakistan Society of Hematology, Commandant Armed Forces Institute of Transfusion, and principal to invite General Salim Rana on the stage. He's the principal of Army Medical College, and he's currently serving as a dean faculty of hematology at CPSP. He's also the executive director of National University of Medical Sciences, which is NUMS. He has authored more than 70 publications in peer-reviewed journal. Our next chair for this session is Professor Dr. Muhammad Khurshid, a highly accomplished and well-respected professional in the field of hematology. He's a distinguished university professor in the Department of Oncology at Aga Khan University and Hospital. He has received extensive education and training, earning several prestigious degrees and fellowship from renowned institutions in the UK and Pakistan. His career spans decades of leadership and excellence in hematology field. Dr. Khurshid, I would now like to invite you to the stage as a chair. We now invite our first speaker, Dr. Mahtab Maqsoodlu. Dr. Mahtab is the professor of community medicine and Department of Microbiology Institute for Research and Education in Transfusion Medicine. She has joined us from Iran. Iran is a country which has achieved 100% voluntary blood donations. Dr. Mahtab's career spans from 20 years when she first set up the donor recruitment department at Iranian Blood Transfusion Organization. And within 10 years, Iran was able to achieve 100% voluntary donation. She then was dedicated her rest of her career in higher education institute in Iranian Blood Transfusion Organization. I now invite Dr. Mahtab for her talk on inspiring transformation in Iran's journey to 100% voluntary donations. Please, Dr. Mahtab.
Salam and good morning. First of all, I would like to thank the organizer for inviting me to such a important conference, blood safety. And today I'm honored to explore, to address to a topic, a great significance, voluntary blood donation. In this presentation, I will explore a brief background about the voluntary blood donation, and then I will focus on initiative and a strategy policy in place to improve voluntary blood donation in Iran, and then we review the statistics of Iranian blood transfusion organization. You know that in 1974, a resolution of WHO urged all countries, all member states, to establish a national and well-organized blood transfusion center based on voluntary blood donation in order to ensure the safety of blood recipients and blood donors. And in response to this resolution, the Parliament of Iran urged the Health Ministry of Iran to establish a national well-organized blood center, blood service, in 1974 that can provide adequate supply of safe blood for all patients in need. And the first step, the first action taken by IBTO, or Iranian Blood Transfusion Organization, was to target to promoting voluntary blood donation system. Okay, some policy and some strategy was determined following the targeting of this program. The first one is no payment, either in the form of cash or reward, is given to donors, which could be considered a substitution for money. The concept of motivational message for donor recruitment should be to encourage altruism only. And blood drive should not be in place where the staff is under pressure. And anonymity between donor and recipient was another principle in donor recruiting. Okay. Following that, we established a national blood donor recruitment department in IBTO. It was two level. In the national level that was located in headquarters of IBTO in Tehran, the responsibility of the national department is planning and organizing program to make a culture of voluntary blood donation in general population, and providing SOP guidelines and observation, monitoring the community, and evaluating the program and training recruiter to recruit safe blood donors. And there are 31 local offices throughout the country in which SOP and guideline of central department are performed. One of the important approach of IBTO was making and promoting of culture of voluntary donation among safe people, especially in young generation, in young people. So some educational and cultural program for young children was prepared in order to gain a new generation of blood donor. For example, we had some content in curriculum of primary school students. Other than, we try to involve community, safe people, because we believe that the best community engagement process is not created in isolation from the community and the stakeholder. So we try to understand the attitude and behavior of the target group to blood donation. And in order to understand, We prepare a lot of focus group meeting, deep interview, take the survey in different group of community to understand their attitude and plan to increase and improve their attitude to blood donation, to voluntary blood donation. And then we try to find common reason why people refuse to donate blood and try to plan to resolve it as much as possible. Raising awareness of target group of low-risk people was another approach of IBTO. And try to find the best target group. For example, young blood donor, we think that who are the key sources of safe and sustainable blood supply. We try to recruit volunteers of Red Cross and Red Crescent, member of community-based organization, donors, families, friends, and colleagues, family replacement donors, and potential donors who have not yet reached at the legal age for donation are the best group for raising awareness workshop and be ready for the blood donation, voluntary blood donation in next future. Convert eligible family replacement donor to voluntary blood donor was one of the other strategy. You know that despite the risk associated with the family replacement donation system, replacement donors themselves are an important target population as potential voluntary blood donors or as advocates for blood donation because they understand the importance of the timely availability of safe blood because of their direct experience of the urgent need for donors when transfusion is required for a family member or friend. The other approach was engage journalists in keeping voluntary blood donation in the public eye by supplying regular reports on blood needs and current blood stock, by requesting a special coverage to support a specific campaign or appeals, particularly in time of blood shortage and when blood is needed. They can help us by providing human interest story and photograph of blood donors and patients who have benefited from transfusion. We can invite journalists to visit blood centers and meet donors and staff and prepare for work and collaborate with the blood centers. And we try to engage popular people to attract public attention to voluntary blood donation. We invite famous people like artists, athletes, singers to donate blood, and journalists help us to spread this news in general population to provide some role model to motivate people, especially young people, to follow them. And the other approach was maximizing the impact of World Blood Donor Day and National Blood Donor events. Before the establishment of World Blood Donor Day by WHO, we defined a National Blood Donation Day in the country to support the culture of blood donation in the country. And we try to advocate with a lot of NGO and Ministry of Health and somewhere to maximize, to promote this day for public people. And we try to improve visibility of blood centers. Blood donation drives or fixed sites should be located in right place. The result of a survey in Iran showed that 3 to 5% of first-time blood donors have decided to donate blood by just seeing the blood center. And you can conduct a survey to explore the attitudes of potential donors toward the location and operating hours of blood donor season. This is the distribution, the pattern of distribution of blood collection sites in the country. We have more than 230 fixed blood collection site throughout the country for better accessibility for blood donors. And about the donor retention, you know that the retention of blood donors lead to a safe and reliable blood supply. Retention of first-time blood donors are more cost-effective than recruitment of new blood donors. And the result of a study show that 50% or more of the first-time blood donors never return for a second time. Okay, one of the most important approach is motivate and educate your staff. Positive staff and motivated staff can open the door for blood donors. And negative and disinterested staff could contract all positive logistic effort. Okay, try to train staff to thank every donor when they have completed their donation and encourage donor to make an appointment for the next donation. And you can investigate and respond to all donor complaints. We try to make blood donors satisfied. We try to create a welcoming space, create a pleasant, comfortable, and donor-friendly atmosphere in all facility used for blood donation, and ensure that they are safe, clean, hygienic, and tidy. And active communication with the blood donor, especially new donor, first-time blood donor, is very important, is very practical to retain them. Being asked to donate is not only an important motivator for non-donor to start donating blood, but also for repeat and especially first-time donor or early career donors to keep on doing so. We repeatedly recall infrequent, inactive, and temporary deferred blood donors. This is clear that temporary deferral deferral reduce the return rate. The deferral rate at IBTO is significant. About 20% of volunteers are deferred from blood donation, and most of them are temporary deferral. And we try to have active communication with them to motivate them to come back again. The result of a study about blood donor return rate after deferral for some reason showed that, as you can see in the table, showed that about more than 51% of deferred donor come back again during 3 years after deferral, and eligible donor, about 74% of them come back again for blood donation during 3 years after the first blood donation. And the recognition program of regular blood donors is very important. Donor recognition and award are important strategy in donor retention, but should not undermine the concept of voluntary blood donation. We can establish a system of milestone award, such as certificates for donors who have achieved a specified number of donations, for example, 10, 25, 50, 100. And this is some medals that IBTO are given to blood donors considering the number of donations, for example, 25, 150. Okay, and this is the statistic of, sorry. And this is the this is the WHO map about the global situation of voluntary blood donation in different countries of the world. And you can see in 2007, IBTO has reached to 100% voluntary blood donation. And this is the trend of blood donation per 1,000 population. As you can see, during the period of COVID-19 pandemic, we have some fluctuation up and down. And now we are starting the development of increasing again. And this is the trend of regular and repeated blood donation rate. And in 2022, about 80% of blood is collected from regular and repeated blood donors. You know that regular blood donors are increase the safety of blood, and this is one of our target. And finally, this is the prevalence of HBs antigen, HCV, and HIV among blood donors. And it's significantly decreased in parallel with improving voluntary blood donation and regular blood donation trend. Okay, and final word, as stated by WHO and other international federation of Red Cross and Red Crescent, IFRC, building a sustainable base of safe blood donors requires a long-term approach that requires not only an establishment of an effective voluntary blood donor program, but also in improving public awareness of the importance of blood donation. Thank you for your attention.
Right. Thank you, Dr. Mahata, for a very enlightening talk on voluntary donations. And this is the whole point, right? If Iran can do it in how many years? 20 years?
Yeah, from
And
2007.
Since 2007. So in 2007, it has
We
achieved...
reached to 100 voluntary blood
It
donors.
reached to 100 voluntary donations. So if Iran can do it in 20 years,
Yeah.
and Turkey did it in 30 years, maybe Pakistan can do it in 50 years.
Yeah.
Okay, and now
Thank you.
I would invite the chairs for their comments or queries before we move on to the Q&A session from the guests.
Thank you very much for your talk. And we are really impressed how you being our neighbor, how you have inspired your population to go into 100% blood as voluntary donation. And what strategy you have described, I think we should take some lead from that. And we would also look forward from your guidance and your patronage about how we can move towards this voluntary donation, because we are still standing at about 10% of voluntary donation. But your approaches of dealing it in a very pleasant way and calling back the first-time donors and other incentives, I think we must follow that. But my question is, how much is your total quantum of voluntary blood donation per year?
Sorry, can you repeat again?
How much is the total donation in 1 year in Iran?
We collect more than 2,100,000 blood collection each year.
And this is your annual requirement also?
Yeah.
It's almost covering everything.
Just IBTO is responsible for providing all blood units for all hospitals, governmental, private sector, army, and all of them, just provide by IBTO.
Thank you very much for very inspiring talk and also an inspiration for all of us.
Thank you.
Thank you. Thank you very much again, as was expressed for this talk. And many of these are initiatives which are being followed in this country also. But our problem is that this is not being done nationally or at a national level, but by private blood banks or local blood banks. And we have no universal regulations that says, that the blood supply will be supplied by a authority like Iran. And I think this has been circumvented up to some extent by the RBC centers, but considering the size of the country, it is not enough. So we are still stuck with private and public institutions catering for their own blood supplies, and for many of us to try and force these ideas onto them. So we have a long way to go, but I think these are the objectives which I think we need to get to. The other problem of blood in Pakistan is the use of blood. The usage of blood, that our physicians are not trained in the proper usage of blood and blood products. And that's another responsibility we have, or what is known as hemovigilance, as far as this country is concerned. But you are a good example to follow, also for your fractionation, in fact, because some of the factor 8 which is available in Pakistan is from Iran, in fact. Okay? So I think we need to keep in touch, talk to each other, and we'll try and see. How does Muharram influence your blood donation?
Yeah, I think you mentioned a very important topic about the usage of blood in the hospitals. I would like to present again about the trend of blood donation per 1,000 population. As you can see, recent years, we try to stable the blood donation per 1,000 population, and along with we work in the hospital, we work with clinicians, laboratory techniques, laboratory staff to improve patient blood management program to establish in the hospital. We hold a lot of seminar, workshop for clinicians to use blood just when is really in need. And patient blood management help us to can modify or need into the blood. I think it's very important, and we are very happy to keep in touch with the Pakistan to improve voluntary blood donation system in your country.
Thank you.
Thank you.
Dr. Mahtab, just please stay on the stage for a few. We have questions. It's an interactive session, right?
Okay, I'm here.
Okay, so Dr. Hassan.
Presentation, Mahtab. I've had the privilege of visiting Iran a number of times, and
Speak like this.
thank you very much, Mahtab. Excellent presentation. I've had a privilege of visiting Iran a number of times and closely observing the excellent Iran blood transfusion system and the Iranian AIDS control program, their thalassemia prevention program, and also the plasma fractionation system. I think there's a lot that we can learn from Iran, and I would strongly urge our national experts to visit Iran and study their systems, and maybe PSH can play a role in facilitating these visits. Thank you.
Thank you.
Dr. Ali Nadeem from Jamshoro.
Thank you, Dr. Mahtab, again for another very enlightening talk. I would like to know your experience and your country's experience, and from our senior colleagues sitting here, about the use and demand of mega platelets. You know, with the advent of this dengue season again, there is a lot of demand. The physicians are demanding mega platelets. So what is your experience and what your country is doing in that?
Sorry, the use of,
Mega platelets, you know, the single donor
I
platelets.
think, are you referring to the donors for the mega unit?
Yes,
How do you
single
get those
donor
donors?
platelets, you know, collecting only platelets.
Okay, okay. Okay, about the use of platelets and RBC, we have a system of inventory management in the IBTO, not in the hospital. And we set that every blood centers should have at least about 5 times about equal to 5 days of usage of hospital covered by the blood center, and about 2 days of platelets for demand of the hospital that cover. And if any blood center, the stock of each blood centers fall down to less than 5 days for RBC and 2 days for platelet, we should do some activity. For example, we send from some center to other center a network system, or if the fall was throughout all the country, we motivate the national department to be here in the television and something like that, to invite people to improve or stock to provide blood and platelet for hospital. But in parallel, we have educational workshop, seminar, and something like that with clinicians to modify their usage of platelet, especially in the season of shortage. And for example, they can postpone their elective surgery sometimes for RBC and something like that, and use platelet just in need and just in apply with the guideline of platelet usage.
Thank you, Dr. Mahtab. We'll take one last question from Dr. Fatma Meraj, Karachi.
Thank you, Dr. Mahtab. It was a very inspiring talk and very eye-opening. I hope we can achieve it even in 50 years. I hope so, inshallah. You stated like IBTO is basically providing the blood to all the public and private hospitals or blood banks, right?
Yeah.
So my question is other blood banks, any other blood bank, either private or public, they are also collecting the donors, or it's just IBTO who's collecting the donor in Iran?
Yeah, as I said that the IBTO provide blood for all hospital, private sector, government, army, everyone.
So any other blood centers, they are also collecting, mobilizing the donors and collecting the blood, or not?
IBTO just provide blood and deliver to hospital. Each hospital has a blood bank that perform a pre-testing transfusion and and pre-transfusion testing for each patient and transfuse with the clinician. The blood bank is separated from IBTO. IBTO has responsibility of providing and distribution to all hospitals.
Okay.
Thank you, Dr. Fatma. Thank you so much, Dr. Mahtab.
Thank you.
So we conclude the Q&A session and move on to the next session.
Thank you very much. Thank you, Dr. Mehta, for a very, excellent, inspirational presentation where we were kind of gossiping that how could Iran do so well and we dedicatedly working, we cannot. Please note one thing, their population is 80 million. We are, I don't know how much, but definitely 240. Why I say no? Because we don't know. Census is another big issue. Are we 240 or 260 or 280? Nobody knows. But please remember that, Mark. And the last very important point, what are we spending? How much percentage of our GDP, or I forget GDP, what percentage is going to the health expenditure of the country? Provinces, the entire nation, they are spending more than 7-8% for their health sector with 80 million population. So maybe food for thought. Thank you.
Thank you so much. And we move on to our next speaker. Dr. Noori, are you online with us? So while I introduce Dr. Noori, Dr. Noori, we can't hear you.
Yes, I can hear you.
Excellent, excellent. So I'll be introducing you, Dr. Noori. Dr. Nouri Solaz is a distinguished figure in blood banking and transfusion medicine. He's from Turkey, now the latest name of Turkey. And he began his career in 1989 as a director for Turkish Red Crescent, Ankara Blood Center, a pivotal blood bank in Turkey. Driven to enhance his expertise, he completed a transfusion education course in Edinburgh in 1992 with British Council scholarship. He played a key role in establishing a hospital blood bank at Ankara University Medical School in 1998 and remained dedicated to the cause until 2010. His extensive qualifications include a master's degree in transfusion and blood banking from Ankara University Health Institute in 2004. Dr. Solaz is a founding member of both Blood Banks and Transfusion Society of Turkey and Turkish Blood Foundation, where he actively contributes as to the executive board. His impact extends beyond Turkey, and he has been an expert in European Union projects on blood banking and transfusion medicine since 2014. Furthermore, Dr. Solaz has been a consultant on the subjects to the Turkish Grand Assembly Health Commission from 2005 and 2000 till 2013. His passion for education and knowledge dissemination is evident through his founding and continuous involvement in Anatolian Blood Days since 2012. He is the vice president of Asian Association of Transfusion Medicine, which we know as ATOM, and he's also the head of the country chapter of Turkey. He holds a very prominent position in the field. I'll also say this, that Dr. Noori was going to join us for this conference in Karachi, but due to some unforeseen circumstances, he was unable to join us. But his commitment to the cause in Pakistan is so deeply ingrained that he spent the whole day yesterday for the voluntary donation workshop. And today also he's here with us, and he wishes that he could be here with us in person also. But Dr. Noori, thank you so much, and I hope all is going well with you.
Thank you so much. Thanks, so far so good. Yes,
excellent.
It is unfortunate that I'm not there in real, but my image and my heart, my good feels are with you. So thank you, and also I really respect what you did in your country. So wish you good luck.
Thank you so much, Dr. Noori. And we will move on towards your recorded presentation, and we will take you up during the QA session.
Okay, thank you. Thank you.
Thank you.
Dear distinguished participants, it is a pleasure of mine to join this conference. I'm going to share our experiences in voluntary blood donation in Turkey. Blood donor has been the most essential factor since the beginning of blood transfusion practice. In another saying, without blood donor, there is no blood banking and transfusion medicine because there is no blood. Volunteer non-remunerated blood donor has been targeted and preferred from the very early times of blood banking and transfusion medicine for both medical and ethical aspects. Family members and the friends were the most common blood donors or givers for the patients at the early days of blood banking and transfusion medicine. This donor pool became insufficient after transfusion practice was performed more often and widely. Military became the next donor pool, both for directed and unknown patients. Just opposite this condition, civilians became the voluntary non-remunerated blood donor pool for the military peoples during the war times. This behavior continued for some time after the war days by the efforts of recently established blood donor recruitment departments or organizations. National Red Cross and Red Crescent societies were most common pioneer organizations as blood provider, donor recruiter, or both in the different countries. Turkey has the similar blood banking and transfusion medicine history, likewise most other countries. The beginning of the transfusion practice in Turkey goes to early 1920s, which had performed at Istanbul Medical School and spread very fast to the countrywide. This progress brought some problems, such as safety of donor and patient due to lack of technical and laboratory insufficiencies. Those days, each hospital, even clinics, were organizing their blood supply by themselves, including blood donor, blood-driven storage, testing, and transfusion. Turkish Red Crescent decided to establish and operate two modern public blood banks in Turkey, both in Istanbul and Ankara. They were established at the campuses of Istanbul Medical School and Ankara Medical School. 1957, both of two blood banks started to provide modern public blood banking services in Turkey. You can see the photos of the opening ceremony of Ankara Turkish Red Crescent Blood Center. I want to show you something which I will use this information in my further presentation. This is the building which was built only for this purpose as a public blood bank according to architectural specifications, and the opening was done by those days Turkish president, and he was the first donor as a kind of model or encouraging, and this shows the importance of political and official support importance for blood banking and for blood donation. I will come to this subject in the future. Turkish blood banks had two main sources on those days for blood collection. Friends and family members as a donors, they came to the Red Crescent blood centers and donate their blood, or Turkish Red Crescent visited the military barracks and accepted the blood from the military people. Those photos were 1967, maybe you can see the bottles, and this is the commander of the battalion donating the first. This is another importance when the leader of the company, university, military barracks, when the top person will support the activity, the result always are so nice. And this gentleman was my father. In 1974, Turkish Red Crescent decided to spread this activity because family members, military donations could not be enough to provide necessity amount of blood for the Turkish people. So they decided to establish a new organization, which is called Blood Donor Organization Department. They organized it in 1974, even earlier than the America. And they hired well-educated, experienced, promotable people. They were three people, and this department started to activate, to motivate the public. They used the documents, the strategies on those days from the Western successful organizations like Turkish Red Crescent. They made their visits to the large-scale industrial workplaces, offices, universities, municipalities, all those places, social clubs. And on those days, those blood donor recruiters were present only in Ankara, and sometimes they were visiting the other blood centers. On those days, Turkish Red Crescent had 6 blood centers to organize civilian mobile blood donation organizations. And you see, those are the photos of those days. This is the meeting for the laborers, informing them about the importance of blood donations and collecting their blood. Although these efforts increase number of donors and donations, unfortunately, I have to confess that activities of this department could not continue longer for different reasons. One of the reasons, unfortunately, was coming from our side, doctors and the nurses. They were not so much happy to make tours around the country, and so they were not willing so much going out of the cities, etc. So they tried to depress the activities of this department. So blood banking and transfusion medicine activities were also considered by Turkish Ministry of Health, because since 1983, we did not have any legal documents about blood donation. And those days, we had even private blood banking. I remember those days. I was a medical student at Istanbul Medical School. I remember a lot of private blood banks, which is called private blood banks. Those are small apartment or small apartment buildings or something, collecting the blood without any safety precautions, nothing. So at this condition, Turkish Ministry of Health decided to regulate all those activities, and they announced the first blood act in Turkey in 1983. And this clearly declared the basics of volunteer non-remunerated blood donation, both in medical and legal wise. And now this act was updated at 2007. Turkish Red Crescent initiated a major reorganization at its blood banking services and established a new blood donor organization department. Because at 2008, Ministry of Health authorized Turkish Red Crescent as the only organization to provide the need of country's blood. And because of this, Turkish Red Crescent had to reorganize itself and its blood banking services. What they did, they established concrete and sustainable policy for supporting blood donor recruitment and retention by the blood provider body, official bureaucracy, and the politicians. As I told you, beginning of my presentation, we saw that the president of the country was supporting this activity, and we got a huge acceleration. So it should be continuous. And to reach as accurate and successful blood donor recruitment, you need an independent or separate organization, which is called a specific department. And this department should have their branches at all regional blood centers. And Turkish Red Crescent did this. Dedicated, sufficient, and sustainable financial support. That is so much important. Without money, without financial support, even there is a good will, dedication of the staff, it cannot be successful to convince the public to be a blood donor. What did also Turkish Red Crescent more? They hired enough number of staffs. Their educational background, social, physical conditions are eligible for being blood donor recruiter. Blood donor recruiter is one of the most essential position or staff of blood services, because those are the main person to convince the public. So even their appearance, their social behaviors, their basic education, and their special education on their services is so important. That's why this stuff should be handled very carefully. And also, for this specific high quality position, you should need high qualified people, and you have to pay good enough that those people choose to work at that position. Turkish Red Crescent did this. When they started first 1974, they had 3 staff. Now they have 215 blood donor recruiters at each regional blood center, distributed all 18 regional blood centers. Another thing, although they are eligible for social, physical, basic education, but they will be doing a special duty. So this is a partially social and that is partially medical. They have to get a special training program. And Turkish Red Crescent organized such a program for those staffs. And it was a 2 weeks special training period. It was an accommodated training course. They invited those people at the hotel, and they made trainings, they made everything. Even they stay at night at the same hotel, and at least those cadets had a chance to discuss during their night breaks with each other to develop their daily trainings. So when this department established, they had to put a strategy. And this strategy had 3 steps. The first one is the short-term activities. They have to evaluate what was their condition. So they have to recognize their weak and strong points, and they made a SWOT analysis. Then they planned their midterm activities. I'm going to talk in details at this topic. First of all, defining responsibilities and rights of blood donor recruiter officially and announced effectively. This is so much important. That was the main reason the first activity at 1974 could not continue. Because of some social and official conditions, there can be some conflicts between the blood donor recruiter and the medical team of the mobile blood collection team. So you have to put everything, what are the responsibilities and rights, as a written, and it should be shared and it should be distributed to the all people. This means that when they organized a blood collection activity in some place, if they plan to work at, let's say, 4 p.m., but if there will be more than expected donors, so if they had to extend their working 1 hour, 2 hour more, mobile blood team medical staff cannot be objected and cannot say that no, it is our time, we finished, we cannot work more. So this is so important. That's why it should be defined and emphasized very clearly. This is the core, one of the core points. And on the other side, this department should make a target, annual number of blood donations. Without any target, you cannot go to a success. You know that if the ship does not know the final destination, it may not reach to any place. Another thing, they have to plan road steps, how they will do to reach to the target. and they have to create necessary tools which that department should use, such as state-of-art IT infrastructures, laptops, trainings, softwares, whatever they needed. On the other side, they need conventional and social media advertisements. Yes, digital is the favorite, popular in our days, but still there are conventional advertisement materials such as posters, flyers, which can be used also as a digitally, but they should be used as a hard copy. On the other side, this department should innovate new attractive promotional gifts. That is so much important. I remember from my experiences, when I was the director of Blood Center, we were planning to make such an activity, and with the donation of a company, we made a special balloons and we distributed it to the blood donors for their kids. A few days later, a gentleman visited me and said that his son showed us such a balloon and he wanted to have one. I said, you wanted to buy it. I told to him that, no, sorry, sir, you cannot buy it, but you can get it if you are eligible to donate the blood. He donated the blood. This is something very simple, but those are really effective. And on the other hand, they have to plan their mobile blood drives. Where, when, how long? Those are so important things. For example, if during Ramadan time, if you will arrange your mobile drives close to the mosques after the iftar, so it will be so nice for the people, because after iftar they eat, and they came to praying. After the praying, it was around 1 hour, 2 hours after the eating, so they are completely eligible to donate. But if you do not do this and stay in the one of the plaza during the fitr time, fasting time, nobody or very few people can come and to donate you. Or if you plan your visit to a town which they have an annual festival, it is a great idea, and there are a lot of people, so you will have so many blood donor candidates, and you can collect more. On the other hand, there's another political side, paying visits to the authorized people of the targeted institutions, which I showed you at the beginning. The commander of the battalion, like I told you, if you visit the general manager or director of the company, or the dean of the university, something, or director of the official building, if you convince that person to support you, either donating blood or supporting you in different ways. For example, they can dedicate a nice place for your mobile sessions, and they may encourage their staff to donate blood. This is so important. That is why blood donor recruiter is one of the essential staff in blood center. If they make a nice communication, because our job in blood banking is not only a medical job. This is the unique field in medicine, which social side and medical side is equally important. On the other hand, collaborating with the NGOs seriously and realistic. That is so important. Yes, there can be some organizations, if you communicate with them, they will convince their community, and you will have sustainable high number of donors. But as I mentioned here, realistic. We had an experience in the past, early days of the Turkish Red Crescent blood activities. There was a kind of organization which was done by the volunteers of the Turkish Red Crescent ladies. They are called Blue Angels. They were working like a blood donor recruiters or something. By time being, they had some conflicts between that group and the professional group of the Turkish Red Crescent, and also it was affected negatively the result of the activity. Yes, collaboration, cooperation with the NGOs is so important, but you should define how it will be done. On the other hand, as Turkish Red Crescent did, there should be well-designed and functional mobile blood collection vehicles. When I worked at Turkish Red Crescent, unfortunately, we had very primitive blood donor collection vehicles. Something, it was not easy even to move inside. You cannot keep the privacy. So that's why people were not so much willing to come and donate. But now, thanks the efforts of TRC, they have very nice, very good facilities, infrastructures, and vehicles. And the long-term activities is another important step. First of all, after the first and second step of the activities, the system should reach a certain point. And we believe that it is a success, but that success should be evaluated. How you can reach this place, what are the problems, what are the solutions, and how you will keep this success and how you will increase this success for the next steps. Now, at 2008, when Turkish Red Crescent authorized to be the only blood supplier of country, they were collecting only 350,000 units per year. So those are the photos. This is the photo for blood donor recruitment training course. And then they made nice connections with the public and the others. So as you see, they donated, not they donated, they have the company let the Turkish Red Crescent to use their meeting and sports hall for collection of their blood. And you see, the Turkish Red Crescent purchased such a nice vehicles to collect the blood, and the number of annual collection will increase almost 10 times, 3,250,000 units. At this point, I want to say something else. Blood donor recruiters and the managers of the blood centers of TRC, they had another activity. They were not working only convincing the people to be a blood donor. They tried to their best to convince the companies, private companies, and the rich people's charities to pay part of it or to pay totally and donate such a nice vehicles to Turkish Red Crescent. And I know there are a lot vehicles were donated to Turkish Red Crescent for blood collection activities. Now, this condition, Turkish Red Crescent is providing 90% of annual blood of Turkey from volunteer non-remunerated blood donors. They are also succeeding to keep the first-time donors for repeat donors and then regular donors. This is so important. Their amount of repeat and regular donors are increasing after those activities. So, if we evaluate Turkish experience on volunteer non-remunerated blood donation, we have to look at the pros and the cons. Pros, as I told you at the beginning, importance of volunteer non-remunerated blood donor recruitment and retention seriously considered by the officials, by the politicians, by the policy makers. It was done. 2008, it was completely done by Ministry of Health, by Turkish Red Crescent General Directorate, and the other related organization. Organizational efforts initiated early periods of blood banking and transfusion medicine in Turkey. When 2008, a new decision was done, TRC had already a background and experience. It was easy to improve and come to a certain point. Failure of the system was recognized by the responsible authorities and reorganization initiatives were started. It was done. Ministry of Health understood, Turkish Red Crescent understood, hospital understood, clinicians understood what were their failures, how it could be overcome. For an example, at 1996, blood transfusion in Turkey was done 96% of whole blood. Clinicians even did not know properly about whole blood and red blood cell. So when Turkish Red Crescent started this, they could say that there would be no whole blood provided to the clinicians unless there will be a specific condition. So it changed the clinical activities completely. So this is the sample recognizing failure and recognizing the success way. There were sufficient sources of finance, manpower, technical and industrial structure to establish state-of-art centers, mobile drives, etc. This is which I mentioned you. Turkish Red Crescent not only changed their mobile drives, they even constructed new blood centers, modern blood centers, as a regional. And some of them were covered by the charities, by the private companies as a donations. And Turkey had such a sources and manpower. Turkey had enough, and we know technical and industrial infrastructure for blood banks or constructions, infrastructures, IT, everything. So those were all pros. Cons, coordination between the staff and blood donor organization staff could not establish it successfully. Yes, as I mentioned, when it was started in 1974, the main reason is communication and cooperation of the blood donor recruiters and the medical staff and the other organizational official parts of the Turkish Red Crescent had a problem. Now, when they were changing their activities, they remembered this bad experience and they took a precaution on this case. Coordination and collaboration between NGOs and blood donor organization department could not be continued successfully. As I mentioned, this is one of the other reasons why 1974 activity could not continue properly. Financial, administrative, and political supports could not be continued efficiently. It was also another reason since 1957, it came a nice point to 1974. After 1974, this financial, administrative, and political supports could not be continued properly. It decreased. Established positive impression and sympathy from the public could not be continued efficiently. Yes, this is another thing. If the organization had any problems and if when it was published publicly, it may affect also to the blood collection activity of the organization. So, as an overview, volunteer non-remunerated blood donation recruitment and retention has been considered in Turkey by the responsible authorities from the very early time of this practice. Although efforts had been interrupted and or failed, reinitiation of the efforts had been realized so far, as I mentioned, from 57, 74, 83, and our days. Turkey has efficient volunteer non-remunerated blood donation recruitment and retention system, and I hope and pray it will keep longer with an acceleration. Hopefully, success and failures of Turkey will help the other countries to establish and continue efficient volunteer non-remunerated blood donation recruitment and retention. There is a special thanks from my side to distinguished colleagues of mine and Turkish Red Crescent who helped me so much while I was preparing this presentation. Thanks for your invitation and attention.
Thank you so much, Dr. Noori. Okay, so because we are short of time, so we'll be just taking comments from the chairs, and the rest of the participants can email their questions on transfusion@tis.org to us. So, Dr. Noori, are you here?
Dr. Shab, yes, Dr. Shabnis, could you please keep my last slide a few seconds
Sure,
more
sure.
on screen?
Okay, so while they're projecting your last slide,
Yes.
I will now hand over the mic to our chair. This is Professor Dr. Mohammad Khurshid and Professor Dr. General Salim Rana for the
But I
comments
cannot
regarding
see
your...
you. I cannot see you.
He needs to see us. Okay, so I'll just hand over the mic to Professor
Okay.
Dr. Khurshid. Now can you see us?
Okay. No, I cannot see you.
I'll send you a picture of the audience.
Don't worry. I can hear you. It is enough.
Thank you very much, Dr. Noori, for your excellent talk. What I could make out from the Turkish success in voluntary blood donation is, number one, it's a public sector activity. Primarily, it's through legislation and financial legislation as well as legal legislation. Primarily in Turkish, Red Crescent Society is making this drive through their public sector blood donation centers. And the important component which you have highlighted is the blood donor recruiters, which are implied in the blood donor centers, whose efficient task is to recruit the people through different strategies. I think this is a very important component for us to learn, that our blood donor centers in public and private, because in our country, both the public and private sector, they are recruiting the donors. So we can adopt this model of your blood donor recruiter employment and give them their task to, at the end of the day, they must, whatever task is assigned to them, we can have their outcome measured. And this is one way we can learn from your experience. And thank you very much for your excellent talk.
It is my pleasure, and also it will be my honor and pleasure to do any contribution to our Pakistani brothers and sisters. I had my first contact with my friend Professor Hassan Zahir, and I want to say him hello about Pakistan, and then continued with Dr. Sabah Jamal. And I really personally appreciate and congratulate your efforts, what you are doing in your country. If I will have a very modest contribution, it will be my honor.
Can I just ask whether all these efforts have been organized by the Turkish Red Crescent?
Yes.
And is the Red Crescent...
As IBTO, the governing body of the country should make a concrete decision and support.
But it's the Red Crescent which delivers. And how does the Red Crescent interact with the government?
Because they have their own incomes, they are refunding the blood expenses from the national health insurance. And as I told you, they had the charities and the donors, except blood donors, to help the efforts of Turkish Red Crescent. Okay. And they established, after they got this duty as an official how can I say, obligation, they understood and they renovated, they reorganized themselves very properly.
Yes, thank you. I think again, I've touched all this on with the first speaker also, that we have a dual system in our country, which is a public hospital support and a private hospital support. And until the two are merged together, we will not have a universal blood supply. And this is something which is our own particular problem. And this needs to be solved. Once this effort of Dr. Sabah Jamal takes ground, then I think this needs to be, and I hope she touches on this when she
Yes.
presents it. Thank you. Thank you.
It's my pleasure. You will overcome maybe a bit system and because of size of your country and population, but I'm totally optimistic, and I believe all your efforts you will reach it. But it will take a bit longer just to keep going on this.
Thank you so much, Dr. Noori. And with this, we move on to
Thank
our
you.
next speaker, Dr. Sabah Jamal,
Thank you.
who will be speaking
Thank you.
on driving change, progresses, and challenges in voluntary blood donations in Pakistan. Dr. Noori, please stay with us.
I'm with you,
Great, great. Thank you.
but I cannot see you.
But I have sent you pictures on the WhatsApp of the
I
audience as well as the
understand.
chairs.
I understand. Now I see. Now I see. Thank you.
Hello, yes. Thank you very much, and I'll try to move fast because we are delayed and we would like to all go for the tea which is already served. So please bear with me. I'll try to move faster with my slides. I was looking at my watch. Let's see how fast I can go. Okay. I'll be today talking about the blood banking and particularly voluntary blood donation because this is that session. I declare no conflict of interest. Well, in Pakistan, the national blood transfusion system, as we all know, does not exist. And health is now, for many years, been a provincial domain. However, the provincial transfusion services also do not exist as a unified thing, like Professor Khurshid said, for the entire province, including both the public as well as the private sector. And blood is basically supplied through hospital-based blood banks and some standalone blood banks. Large majority of the blood is supplied by the public sector hospital, which is around 70, 75, maybe 80%. Across the country, we are not talking about the larger cities, the semi-urban, rural. And replacement donations are the primary source of blood for patients. According to the current estimates, about over 3.5 million units of blood are collected in Pakistan annually, and of which most of it is replacement family donors, and approximately 10 to 13% are voluntary blood donors. We have not exceeded that number yet. And the voluntary blood donations, if you see, are mainly for special needs like thalassemia, etc. The NGOs are doing it. Our hospitals are basically relying on the replacement donors. Furthermore, there is a general belief in Pakistan that the replacement donors are safe as they are mostly families and friends. So they are supposed to be healthy and they are safe. If you look at this is our current data we just published. It's about 0.6 million donors. And if you see, there is it's published with semi-urban, urban areas. As we go into semi-urban areas, the positivity rate of hepatitis B, C, HIV increases, and the difference between the voluntary donors, the positivity in voluntary donors, as well as the replacement donors is much high, and it all shows significant values. And this is so bothersome. Look at the double infection of 0.6 million. And the difference is, this is the largest published data of 0.6 million donors with 100,000 voluntary donors. Double infection, look at it, the numbers in the replacement donors and the comparison between, and these are high risk patients, and these are the patients who when 25% of them have been deferred when they come for history. We have a very strict 25 questions questionnaire where we defer donors. And after that, this is the positivity rate. So the conclusion in our study was that there is high prevalence. Usko minimize kar dein, please. Jo wo nazar aa raha hai. High prevalence of TTIs and between amongst both the replacement donors as well as the voluntary donors. However, higher prevalence was observed. Highest prevalence was observed for hepatitis C. It's up to 9% in certain areas, up to 30. Yes, it's very high. And in both type of donors, but the difference between urban and semi-urban areas is significant with the highest rate of overall TTIs in semi-urban areas. So the more you go into semi-urban and rural, the positivity rates keep on going high, but there is a difference between, even there is a difference between voluntary and replacement donors. So Pakistan really desperately needs voluntary blood donors. These family donors are not really safe. This has been published. You can do the internet search and read the details. What the problem is that the voluntary donation at national and provincial levels is the issue. There is lack of cohesive strategy for voluntary blood donation, mobilization campaigns at the national or the international level. Voluntary blood donors are not recognized whether they are at the national level or at the provincial level. They are not given that importance. Furthermore, all the efforts are at organizational levels, not at the highest level where all organizations benefit from it. And again, like I said, mainly for thalassemia patients or hemophilia patients. And there is a problem there too, because it's not at the provincial or the national level. The same multiple organizations, NGOs, and whoever is working on voluntary donation is competing for the same sites, for the same donors, rather than increasing the number, the overall number. That's one of the other problems. Blood requirements for hospitalized patients still remains with the replacement donors. There is, again, lack of provincial or national registry. There's no big data available on these voluntary donors. Even they may be 13%, but there is no large data at the national level or provincial level, which needs to be there. So I didn't have the national data to be shown. What I thought was, let me show some of our data, what we have tried. We started in 2013 with the vision of this: provide the safest possible blood, meeting international standards to all segments of the society without any discrimination. And actually our mission is, for now, mobilize the nation towards 100% voluntary donation, and I think it will be for my lifetime. I don't see the end of the dark tunnel yet. And if I just create and leave behind a generation of enthusiasts who just own this, which we are trying, and I am very much encouraged by the younger lot that we have inducted. They are enthusiastic and extremely hardworking. This is our history in 4 sites where we opened, and this was the first. I still feel it's small. It's not at the national level, but at least in 2 provinces, we made an attempt to learn and we hired professional sales personnel in the donor mobilization team. Each center has its dedicated team, and their annual appraisals are basically based on targets. And IHHN campus, in fact, the Karachi campus, have tried to make the first attempt to get the blood for the hospitalized patients and have those numbers there. And if you see, this is our journey of about 10 years. We started with, I was surprised, with almost 10,000 voluntary donors day. And this is all for hospitalized patients. And if you see the percentages, we peaked in 2018, where we were getting 95% of our collection from voluntary donation, and it was about more than 26,000 donors. And then COVID hit. It started going down. The numbers you can see are lower, around about 24,000, and COVID really hit hard. It had some good aspects. We were able to break through into some of the larger religious groups, and we got some fatwas which played a pivotal role even to get this donation. And we are still having problems in going up to those numbers, and there are multiple reasons for that. And the main thing that I have observed with data is that the large, huge number we were getting, like in certain camps, we were blood drives, mobile drives, we used to get 700 donors, 500 donors in a matter of 12 hours. Because maybe of COVID, the systems have gone in the same organizations. We are hardly able to get 200 donors. So we are at this point battling very actively, and Dr. Shabnees and I are actively involved. It's become almost 25% of our task to work with our donor mobilization team. This is the Bhavalpur and Multan data which I have aggregated. And if you can see again, because here our replacement donors numbers are very high. It's around 100,000 units in these two centers. The percentages are low, but these were the sites, these are semi-urban sites where voluntary blood donation was actually introduced to the community in that environment. And it has gone up to about 13,000 to, again, 12 to 13%, but then the total collection is very high. This is Jamshoro. And if you see, our replacement donors have gone up to 70,000 as the network has expanded. We are having much more problems in Jamshoro and Sindh, and I think it has to do a lot with the level of education, etc. In the bigger cities, we are getting bigger collection, but in the other smaller cities, it's an uphill task, mostly small blood drives. Ramazan, the first Ramazan was a killer for us. We were taken aback, but then we came back very strong, approached a lot of religious groups who had big Taraweehs, the namaz, and Dr. Bari was also instrumental. I had a problem. I couldn't approach the religious muftis being a female. And so I basically bullied Dr. Bari to go in. Otherwise, I will go in. And he has always been a big supporter. He's a big donor mobilizer himself. And if you see, this is Karachi. It is possible. In 2018-19, we were collecting as many, and the blue bars are the blood drives. And again, like Nouri said, we collect post-Taraweeh. Our team moves in during the opening of the Roza. They are basically traveling. They are given food, everything in boxes, while people are having their Maghrib namaz, and after that, that's where they set up their blood drive. And then the blood center is just functional throughout the night. It's a full nighter which we draw, and the more we get closer to the end, the more it gets. And major breakthroughs have happened. With even they have let us go into major religious areas, and I think we can, if we are able to tap more of the larger religious groups where there are massive collections even during the non-Ramzan, it is possible even in Ramadan. We are having the same issues of decreased numbers, but we tried the same in Multan Bhalpur. If you see 88 blood drives, 75, 1,000 collections. So this is even possible in semi-urban areas. Same thing in Jamshoro, 44 blood drives and all. So we did go up to around 500 donors, which to me is still encouraging, where it's at one organization's level. If you see, I had tons of data, which hopefully will be published soon, but I just wanted to show you how different it is. These are the sectors where we basically play on data. So half the time we are looking, my major time is looking at data. If you see in Karachi, there is almost an equal distribution of corporate industries and the industrial area, corporate sector, and education. Green, orange, yellow. We even do it in madrasas. So that happens. We do it in Western educational institutes, but a lot of madrasas are collaborating with us where the muftis are being trained. They donate too. But if you look at Bhavalpur, because it's an educational city, I call it the Aligarh of Pakistan. See, 42% educational institutes. And look at Jamshoro, it's a big mix. Multan Bhalpur is heavily reliant on, and these are sites where the blood drive goes on for days on end. This department, and hundreds of units are collected. But in Jamshoro, it's a mixture. And if you see the yield, because we see that too, there is a cost to, you have to be wise with your money, cost to setting up a blood drive. It's an expensive business. So if you see the yield in Karachi, 30, if you see yellow, the mustard is education. It comprises 21% of our organizations, but it is yielding 30% of our donors. So we have bigger collections in these. And in Bhavalpur and Multan, if you see, it's the same, 42% and 52%. So there is bigger collection. But again, in Jamshoro, it's a big mix. So volunteer donors are really available during periods of emergency, but not otherwise. Number of reasons exist. Donating blood. I've interviewed a lot of people, and I've realized donating blood without a recognizable return is not easy to understand in this increasingly materialistic world. And this is another problem. The same individual who has donated voluntarily because of lack of a national system has to find donors and pay for the blood transfusion if he or she requires blood or the family members require. So that's also another deterrent. If I need it, what will happen? Because it's not available. So that to me is also a main hindrance. Commercial motives exist within the blood banks. Concerns, if you talk to people, they have concerns about the misuse of blood. They have poor facilities at a larger scale is also a fear. Poor donation education, lack of national level mass media campaign. After looking at a lot of data, I've come to the conclusion, unless we have mass media campaigns across Pakistan in regional languages and national language in Urdu, this is not going to happen. And there is a lack of political will, which we need to educate our policymakers more, and so that we can do mass level mass campaigns. What did we do? What was our strategy? We strategized as per our religious beliefs, etc. Actually, top tier management spearheaded. It was amazing. I was basically doing it for the first 2 years, and I wouldn't get my foot into different organizations. And half the time, when I was talking to the top level, they would literally say to me, if you bring Dr. Bari along with you, we'll meet with you. So I would call Dr. Bari, I need you as a celebrity to come along with me. And I really thank him. The first 10,000, he would go for he would laugh and he would say, oh, I used to collect money. Now I collect blood also. So when I go to any organization, I tell them, oh, I'm here for the money and the blood, both. So he would come to my office, give me 20 cards. I have talked to them, call them, arrange it. So I had hard time like running around, calling everybody. Dr. Bari will talk to you. We need a camp. So yeah, I think that has been the main role. And Indus is Indus had, I used to think, how come we are getting all this? And then I realized, you know, there have to be reason. Allah has ways of doing things. We were working in 2005, 6, 7 with Elaine, trying to get the things up, the technical side up, and Indus was being built. And when we started, Indus had already had 7 years of respect from the community. And that respect really held us. We were so respected anywhere I've gone. I've never felt, I feel if it was not Indus, it would have been more difficult because they had already gained respect in Karachi's community for their hard work. And I have emailed all the doctors initially. I would email everybody, the whole faculty, and thank them. Thank you very much for giving your services in a way, because this is the first time we are going into the communities. We are seeing what is thought of Indus, and the kind of respect I'm getting it's not because of my hard work. It's because of it's not just the top team, it's the faculty and the nurses and everybody that works there. And establishment of recruitment teams from corporate sector, we then shifted to that. We hire people person, arrangement of inter-organizational references are also taken, cold calling is also done. And we have tried to give as the highest standard in blood drives. And that has resulted in where CEOs, the top tier comes, and I agree with Nouri and Mahtab that's my experience too. When the top tier donates blood, is the first one to donate, the whole system donates. It's like that is the key point. We also had a macro perspective. So this was all created. We hired professional graphics people. This icon doesn't have the drop Indus in it. And the graphic design, we had certain question, why is Indus not written in it? Our graphic designer, Asif Shah, he had an argument with me. He said, the Nike swoosh doesn't have Nike written in it. This will be recognized. I tell you, this will be recognized as voluntary blood donation icon for the country. I will not write Indus on it. And I was like, yeah, I'm with you. Let's do it. So, and that is the power at Indus. I just went to Dr. Bari. I said, no, too bad. You can't get Indus in it. And he did not force me. I said, this will have to turn into the swoosh of Nike. So this is open for everybody to use, because that's what he said. I said, you know, the top tier is complaining. He said, it's your job, not mine. I will not change it. And I think he was right. Now, Dr. Bari, within the first year, was calling me that, you know, people call me, oh, your blood drive was there. We can see that icon. It's Indus. So I'm like, no, this is not Indus. This is voluntary blood donation. So we follow the micro perspective was that the donor has to trust us, that this is international standard and they are in safe hands and the patients are in safe hands. So we email all the results automatically. Donors reactive are counseled. That's a big department. We even try to get them into programs into Indus, those who can't afford to get treated. We give appreciation certificates, a lot of things. Then we fulfill. That is one major thing we have had to do. People have this fear of what will happen to me. And the interesting thing is, the top tier requests for it, the CEO, you know, in the biggest private hospital, they are saying, if we have seen the standards, we will want this for us. So what we have had to do is, we fulfill the requirement of the voluntary donors. And again, it's the Indus board, the top management. We do not charge anything. And with my idiosyncrasies, that's why I always laugh. I've ended up in the right place. All my idiosyncrasies are catered to. I said to the board, to Dr. Bari, no, we will not hand over the blood to the patients. And they were like, and so how will it get there? I said, when it's quality assurance from, we have to maintain the cold chain. So Indus our vehicle goes, we get the name, the patient's family brings the sample, but our vehicle, cold chain maintained, goes to respective hospitals. That's a big expense, and delivers, gets a receiving from the family, delivers to the blood bank, it gets saved there. And this has gone up from 2% to we are basically delivering about 8%. But the good thing of trust is, like I'm saying, at the most expensive hospitals, the CEOs, the top level of those people are like, we want the blood from here. So, but that is a requirement unless we have a national service available where the blood is available for all of the same quality. And again, we deliver it, like I said. And what do we do? This is the last slide. When we do our blood drives, it's a big exercise. Once we have the date, we do a pre-hype on sites, which is we have posters, banners, a big store where everything is already printed or mass scales. We have electronic media stuff too, which we share on WhatsApp, Facebook for that blood drive for that site. Big motivational campaign. And then we use social media also, and then do the drive. And I will thank ISBT for endorsing this and also financing a lot of budgets. Thank you very much, everybody.
Thank you so much, Dr. Sabha. And I will hand over the mic to the chairs for their comments.
Thank you very much, Sabha. It's a wonderful journey under your leadership, and how these blood banking has progressed under the Indus sector. I think it's extremely encouraging for all others to follow that. I had just few comments. We have listened to Iran, Turkey, and our model. Primarily, their models are going through public sector. And our model is primarily running through NGOs and private sector. I think we have to talk to, at your level and to the level of Pakistan Society of Hematology, to the public sector, to come forward. And I think I'm already trying on it, and will make our team within PSH to go to the provincial sector, the authorities and the ministers and the ITOs, to build a national and a provincial system, which you have highlighted that there is no existent system. And I think that Pakistan Society of Hematology, having all the experts within their ranks, can do this voluntarily. So this is what I think so. But in your presentation, if Karachi Indus Center can go to 90% voluntary donation, that's very appreciable. So others can also in Sakhar and Multan, the same techniques may help, I think so. So let's move to the peripheral sector also.
It has to be a national movement. I've come to the conclusion after reviewing data, it has to be a national and a provincial, a national movement with all of us working together along with the policymakers. Otherwise, it will never be possible.
And the last point, you said that in our setup, the organization, the industrial sector, the private sector, the boss and the CEO, if he comes on board, everything happens in our voluntary. I cite you an example from my own service many years ago when I was a junior officer and in charge of a blood bank in a city, in a lab. There was a big blast, and blast happened to the servicemen, to the army, and there were a number of casualties. And our blood bank was not good enough to handle that. I rang many of the staff officers in the headquarters that we need more donation, but the response was not that adequate. तंग आके मैंने जनरल को रिंग किया जो जीओसी इंचार्ज था. मैंने कहा सर, कहते खैर है. मैंने कहा सर ब्लास्ट हुआ है, हम वी आर हेल्पिंग बट देयर इज नॉट एनफ रिस्पांस. मुझे कहते आप फोन रखें डॉक्टर साहब. थोड़ी देर बाद जीओसी वाज इन द ब्लड बैंक डोनेटिंग. उसके बाद आप सोचे कि हमने शाम के बाद लोगों की मिन्नतें की कि हमने नहीं लेना ब्लड. तो ऑफिसर्स ने कहा कि सर जी सुट देना ब्लड, लेकिन मैं वापस जाके हाजिरी लाड़ी है. This is how it runs here.
So thank you. That was really, most of us could relate our own experiences to what you've just said. But if we look at things prospectively, my introduction to Pakistani blood transfusion system was in 1984 when I joined Aga Khan. And the first thing I had in my office was a letter from a blood broker, the next door hospital, saying that he is supplying blood to LNH and he would be very grateful if I could give him the order for the blood at Aga Khan. And I just couldn't sort of fathom that. Anyway, it's a long story, and then we went through what you're going through. And now I think with a number of trained people, with a number of good ideas coming through, I hope that eventually we will succeed in establishing some sort of provincial or if not national blood transfusion service. And most of us at hospital level will not have to worry about where to get blood from. And I think that that's the objective we should, that is where we should aim for. And maybe in the end, we will all have to pool resources to do that. The financial side will have to be worked out. I mean, many people, if it, say someone like AKU is still paying for its blood banking service. How they contribute this to a provincial level is going to be something different. You know, I think as long as we start thinking in that direction, may take years to achieve, but we have to get there. Thank you.
Thank you, sir.
Thank you so much. So I would now request Dr. Abdul Bari Khan and Mr. Mohammad Ali Sheikh, Special Secretary Health, to come to the stage to present the shields to the chairs, speakers, and moderators. I would request Professor Dr. Salim Rana to please come on the stage and receive the shield. And I would request Dr. Salim to please stay on the stage. And I would request Dr. Khushi to please come on the stage to receive the shield from Special Secretary Health and Dr. Bari and Dr. Salim. Please, Dr. Khushi, please stay on the stage to present the shield to Dr. Mahtab Maqsoodlu, who's here from Iran. And thank you so much, Dr. Mahtab, once again for your enlightening presentation and for visiting Pakistan. I would now request Dr. Sabah Jamal to please come on the stage and receive the shield. Thank you so much.
Joint Secretary.
Oh, yes. I would now request all the chairs and Dr. Bari to stay on the stage to present the shield to Special Secretary Health, Mr. Mohammad Ali Sheikh. From Dr. Bari. And we thank you, sir, for gracing the event with your presence. And we also request Mr. Mohammad Ali Sheikh to present the shield to Dr. Bari. Yeah, we missed it in the first session. Thank you so much. Oh yes, I also need to receive the shield from the. Right, so I'm sure it has been a very lengthy session and you must all be waiting for a very nice tea break. So we now request the delegates to proceed towards the Agenson Hall for tea break. We have 30 minutes because we want to complete on time. Um, oh yes, yes, please.
Bismillah Rahman Rahim. Assalamu alaikum all audience. On behalf of Secretary Health, Government of Sindh, Dr. Mansoor Abbas, who requested me to attend this gracious occasion on behalf of me and on behalf of my secretary and minister, both are doctors, though I am engineer. But later on, I got commission in Government of Sindh and become officer. Today, I really congratulate Indus Hospital and for organizing this colorful event to be more prominent and make it more evident and manifest to the people about the importance of blood donating. I, in a single sentence, would like to say that a flagship program, Government of Sindh, is going to be initiated and it will have two phases. So in future, besides the participation of the private sector, you will witness that there is also a government effective factor in blood transfusion and blood donating sector. Thank you. And lastly, I would like to say that though we are lacking in every field, but it is very appreciative that we are almost addressing every sphere so far in every field with the world. So hope that inshallah you will see that there will be a more positive and constructive and implementing role on the side of Government of Sindh. Thank you very much.
Okay, so you can move towards the tea break, but a very big but, because this CME, this is a CME accredited session. In your folders, there are 3 forms. There's 1 registration form, 2 feedback forms. You need to fill it, and before you leave the event, put it in the drop box outside, and you will get your e-certificates for this event and CPSP CME certificates as well. Thank you. Please move on towards the left side of the hall towards the tea break. Much awaited tea break.